and gentlemen, I'm going to tell you something about bleeding from nose. Technically, we call it as epistaxis. उर्दू में कहते हैं कि नाक में से खून का आना या नक्सीर. It's quite common problem in the all SAARC countries, India, Pakistan, Bangladesh, Sri Lanka. I've seen such situation number of times in my life. Patients are coming, especially in the hot weather. My clinic is this one, RANA E.N.T center is just opposite KUALALUMPUR College, J Road, Lahore, where I'm doing the E.N.T work for the last 30 years, giving relief to the patients. Patients are coming from Daska, from Hyderabad, from Faisalabad, from Sakkar, from Chakwal. Today I have received a patient. He was having bleeding from nose. It could be in all the age groups, maybe smaller children, maybe middle age, older age. Older age, I will give this test especially when I organize the third SAARC E.N.T conference here in PC Hotel Lahore. There was a special paper which is called as the State of Art lecture on epistaxis. They told that it should be handled carefully. Older people, they have got, less, body support. If they bleed too much, they can die. Mostly it is due to the hypertension. Older age group represent with the problem when we test. They are hypertensive patients. Their hypertension is uncontrolled. They are not taking proper medicine. It shoots up, but it's called as when there is epistaxis, it is a blessing. If there is no bleeding in the nose, then the bleeding will take place in the cranium, that means in the brain. Then there is a brain hemorrhage, which is called as the CVA, cerebrovascular accident, which gives either paralysis or it can kill the patient. Therefore, by making some bleeding from the nose, in the lateral area of the nose, interior part of the nose is having this, bunch of arteries from where the bleeding start taking place. This is my experience of MAYO hospital also, where in E.N.T department I have worked as house surgeon, medical officer, registrar, senior registrar, as assistant professor, as associate professor. In such capacities when I worked, the emergency used to come. I still remember a case which came from Daska. The case came from Daska to Gujranwala DHQ hospital. There was no E.N.T specialist at that time there, because the post for E.N.T specialists were created in 83-84. I'm talking about it 182. When the case came to us, then we had to do a lot of struggle. We had to go push the post-nasal pack also. We had to transfuse 1, 2, 3 pints of blood, but we saved the patient. I still remember that case. That was a very typical case. Such cases we see also when they come to me opposite this KUALALUMPUR College. I've got this RANA E.N.T center, and we'll handle them. There's no problem, but it is with the system, not haphazardly. First, we have to calm down the patient. When the patient comes to the doctor, bleeding from nose, he's tense. His attendants are also very much, they're in the panic condition. We have to first console and don't ask the patient to lie. We ask him to sit like this. Then we have to examine the nose, and if there's a bleeding point, we can cauterize. If there's a bleeding point is not visible, then we can do the nasal packing. Mostly cases they are settled, and then according to the cause, if there is a patient is hypertensive, we can give the medicines to control the hypertension along with some antibiotic. But if the patient is still not being recovered, and there is a bleeding on the posterior side, which is called as the post-nasal space, is coming from the blood is the patient is spitting out. Such situation we have to give the post-nasal pack. These are very technical terms, no doubt you will not be understanding it unless you do not see the post-nasal pack. These are the means by which we have saved so many patients in MAYO hospital, which is the oldest hospital of this area. It was made in 1870 by the British government at that time. And the attached medical college is King Edward Medical College, where I have been teaching to the 4th year final year MBBS students as assistant professor, as associate professor. In Patala, you can see I am going with the principal of the college, Professor Iftikhar Ahmed, in the main block It is our, you see, place where you cannot imagine such a prestigious place. When I went to India in the fifth SAARC conference, which was representing the E.N.T specialty, believe it, when I told them that I am from the King Edward, they used to see like this because their fathers, their grandfathers, they used to come from Delhi to study MBBS from this medical education from King Edward Medical College. Now I'm going to tell you something about the, you see, the World E.N.T conference which took place in Cairo, the capital of Egypt. I have seen the incidence of epistaxis too much in that country because there's a hot, you see, weather, sunshine, temperature is too much, dry heat, it causes vasodilatation in the nose. The World E.N.T conference, I am standing with the, you see, international delegates in the pyramids and also there in the conference. They told that epistaxis should be handled in a very nice way, otherwise it can kill the person. Then I represented Pakistan there in Washington DC. The conference name was Nose 2000 and Beyond. There they read the papers and I am standing up, you see, with the delegates who came from the 160 countries, and they said that this is a common problem of E.N.T. It's a common E.N.T emergency. Wherever there is a, you see, emergency department of E.N.T, we used to get this E.N.T patients in the shape of bleeding from nose. Then this fifth SAARC E.N.T conference, I did the candle lighting ceremony of the fifth SAARC E.N.T conference in ASHOKA hotel, which is the biggest hotel of this area, of the subcontinent. And the senior-most people, including their health minister RANA, their DG Armed Forces Medical Services Admiral V.K. Singh, then Professor Venkat, they all are standing there and did very good, you see, work by conducting the E.N.T fifth SAARC first time in New Delhi. New Delhi is a state capital and a federal capital also. It's a huge, you see, city, getting a lot of facilities. Then Professor Decca, who was the Dean of AIMS, All India Institute of Medical Sciences, he took me, he said, Dr. Saab, you just come to me, to my AIMS, I am going to show you something, a wonder. I went there, it's the biggest hospital of the whole area, South Asia, and no hospital is having such bed capacity in either in Pakistan or Bangladesh or Sri Lanka. New Delhi, it is catering the, you see, whole population from more than 40 provinces of India. They come there for some gynae, from medicine, from surgery, but Professor Decca was E.N.T person, technically. He gave a lot of, you see, respect to me, he gave a lot of love to me. He said, okay, I am going to show you a very special operation I am going to perform. However, I went to his office, then he took me to the operation theatre and he showed me the cochlear implant surgery and he performed in 35 minutes. I have not seen such surgeon in my life in New York, in Washington or anywhere. Then he gave me a cup of tea and said, okay, you can come again and you can see this. We are going to teach you something about this cochlear implant, which is a breakthrough in the treatment of deafness. Then there was a conference in Pakistan, third SAARC E.N.T conference I organized. In that conference, they gave me the, you see, gold medal in recognition to my services, that I did a lot of work for the SAARC countries to hold this conference in PC Hotel. Thank you very much.